Good morning, good evening, and good afternoon to everyone joining us in today's Q&A Ask WHO session with Dr. Maria Van Kerkhove on COVID-19. For those watching us on X, please use the hashtag AskWHO to send us your questions. For those watching us on Facebook and LinkedIn, you can use the comment section. And for those watching us on YouTube, the same. I am pleased. My name is Alexandra Kuzmanovic, for those who maybe have forgotten me. We haven't done those in a while. And I'm very pleased to be with Maria here today, who is our acting director for epidemic and pandemic preparedness and prevention, and also still the main responsible for our COVID response. Good afternoon, Maria. Thank you for your time today to talk to our social media followers again, as it's been almost 5 years since first reports to WHO of pneumonia that was at the time thought to be caused by an unknown pathogen. We're not talking about this virus as much anymore, but it's still around. So maybe we can start as usual with providing our viewers with some epidemiological updates. How much is this virus around and affecting people around the world?
Well, thanks, Alex, for having me, and it's really great to be back again. It's been a while since we've done one of these. We really don't hear so much about COVID anymore, but this virus is still circulating. It's the SARS-CoV-2 virus, the virus that causes COVID-19, and the virus is circulating pretty widely around the world. We don't have as much visibility on this as we used to because there isn't as much testing, surveillance has declined, reporting has declined, but we do know from multiple types of surveillance systems, whether these are from patients who are showing up at hospital and getting tested, or from wastewater sampling systems, or for other types of systems, we know the virus is circulating, and it's circulating in all countries. What's very different now, 5 years in, is that the impact is much less than it was at the peak. And everyone, I'm sure, remembers the peak in 2020, 2021, when we really had overwhelmed health systems. We have right now about 4,000 deaths per month that we know about, but only a few countries are actually reporting death data to WHO. It is still causing a significant burden. Again, nowhere near where we were in 2020, 2021, 2022, but this virus is here to stay. And so what we have to do within governments and within countries is manage SARS-CoV-2, manage COVID-19 like we do with other respiratory pathogens. And as individuals, you need to be aware, especially if you're in a higher risk group, if you're over 60, if you have underlying conditions, what you need to do to keep yourself safe. But we're in a very different situation than we were 5 years ago. We've now been living with this virus for 5 years now, starting year 6. So it is something that's still very much there, and it's still very much something WHO is working on with all of our member states.
Thank you very much, Maria. And in the past conversations, when these conversations were more intense and more often, we used to talk a lot about variants, and I think all of us learned a lot what the virus variants are.
Yeah.
So are there any new COVID-19 virus variants and maybe more dangers that we should be aware of?
We at WHO are actually still talking about variants all the time. And with our TAG-VE, our Technical Advisory Group for Virus Evolution, we meet regularly still because the virus still evolves. So as I said, the virus is circulating, it's still evolving, it's still infecting, it's still killing. There are a number of variants that we're tracking. Most of these are of the JN.1 sublineages. I think people have lost track of some of the numbers. These are all still Omicron subvariants, sublineages. So we have a number of JN.1 sublineages that we are tracking. And for those of you who follow this very carefully, we have several variants under monitoring, including JN.1.18, KP.2, KP.3, KP.3.1.1, LB.1, and XEC. I mention those specifically because we have dedicated scientists and public health professionals that are tracking this with us. And the data comes from labs, which is now part of a coronavirus lab network that we've established since COVID. And currently, the risks associated with these subvariants are similar to the Omicron ones. They cause the full range of disease from asymptomatic infection all the way to death. your risk increases with increasing risk factors like older age, underlying condition, and really importantly, if you haven't been vaccinated or you haven't been vaccinated recently. And by recently, I mean within the last year.
Thank you very much, Maria. We've already received some questions from our viewers.
Okay.
This one is from someone watching us on X. And the question is about how concerned we are about COVID-19 reinfections and rising risks of long COVID.
So that's a great question, and thanks for bringing up the long COVID to whoever posed that question. So one of the things that we are tracking is not only circulation and impact like hospitalizations, admissions to ICU, and death, we're also looking at post-COVID-19 condition or long COVID, and we're working with countries to make sure that they have systems in place to deal with the acute disease, so people who get infected and they get sick, but also the long-term effects like long COVID. We do know that the risk of developing long COVID increases with additional infections, but vaccination reduces your risk of developing post-COVID-19 condition. And we do know that at least having two doses of COVID-19 vaccine reduces your risk in half. But it is of concern. The definition of long COVID is very different around the world. We have case definitions, which we are encouraging clinicians and governments to use. There are studies that we are trying to support in countries to make sure that we understand why people are developing long COVID, and for those who do develop long COVID, what could be done in terms of the treatment, because it affects multiple organs. We know about, our estimates are not great, but we do estimate with many researchers around the world about 6% of people who had symptomatic COVID, so had some kinds of signs or symptoms, have gone on to develop post-COVID-19 condition. And that duration of post-COVID condition lasts anywhere from 4 months to 1 year, and in some cases even longer. Many people recover from this. But the bottom line is that we still need more work to be done. Our clinical teams here are working with patient groups. Very grateful for patient groups for coming forward as early as August 2020 and working with us and saying they wanted recognition, they wanted research, they wanted rehab. And we've been working on it with them, with clinicians around the world to develop therapeutic options, to look at prevention, to look at treatment, but also the overall support for people who are going through this, because it is very detrimental. And for many people, they haven't been able to work, and it affects children as well as adults. So this is an area of work that's quite active for us, led by our clinical team here.
Thank you very much. And Maria, you just spoke about long COVID, and we are getting again a question from someone. What is our approach to tackling long COVID, in particular cardiovascular and neurological symptoms?
Yes, so post-COVID condition affects multiple organs. So cardiacs, your heart, your lungs, your brain, mental health aspects as well. And so the approach to long COVID needs to be multi-organ. It needs to be multidisciplinary. And not only looking at treatment options, but making sure that when a patient shows up in healthcare, that governments are including this type of care in the clinical care pathway. So whenever you show up, you get the right diagnosis, you get the right type of care, and that would include multiple doctors. And doctors that are looking at different organ systems within the body, but also looking at the different types of treatment. There are a lot of studies that are coming out now that go into quite some detail about how people develop post-COVID condition, but we're still learning quite a lot. I mean, I know it's not in the news so much, and I think everyone really wants to move on and not talk about COVID anymore, but it's an area of active research, and I encourage funders who are out there, those of you who would be willing to support this type of research, to really invest in post-COVID condition, but also for governments to make sure that when you're dealing with the care of COVID patients, that you also take into consideration that long-term care.
Thank you very much, Maria. We're getting more great questions from our viewers.
Okay.
Here is the one from Aman Anand watching us on Facebook saying, how is investing in health useful in fighting diseases?
Oh my goodness, we could spend the whole time on that one. Health is a right, and investment in health, investment in primary health care, investment in prevention, investment in universal health care is something that is so fundamental to WHO and what we do. It is really important that all governments invest in the health of their people. I think it's worth noting right now that because of the pandemic, because of how much attention COVID took from everything else, decision makers in government are really struggling with how to balance the investments that they make across all of the sectors. How much do they invest in health? How much do they invest in education? How much do they invest in the economy and whatnot? And given the complexity of this world that we live in, with economic crises, climate change, with war and displacement, with climate disasters of floods and wars, it's very, very difficult for governments to find the funding to do this because the fiscal space has shrunk. But we advocate for the investment in health, because investment in health and in people and their livelihoods, but also in prevention, is much better spent than on response. This pandemic, there's estimates that it in the trillions, but in the millions that we could spend in investment in health, it could ward off that next potential pandemic. And we are constantly looking at what might be that next outbreak, that next epidemic, that next pandemic. And for us at WHO, we're in a constant state of readiness of what might it be. And how do we use this experience of COVID to actually help us be better prepared for the future?
Thank you very much, Maria. Here's one more question on a similar note from someone watching us on X. How can WHO influence governments to inform proactively about possible sequelae and to discuss prevention?
So the best thing that we could do to prevent the long-term sequelae is preventing further infections. And so we still advise taking a risk-based approach for individuals. There's a lot of things that we do now that we might not have done before. Some people, and I've just been doing some traveling around the world, I see quite a few people wearing masks when they're in crowded spaces. And I particularly see those among older individuals. And I think that's wise. Depending on your own situation, the underlying conditions that you have, the nature in which you could be in a crowded situation, to make sure that we look at prevention. Vaccination remains really critical for COVID-19. It's one of the measures to prevent severe disease and death. It does prevent some infections, but it's really aimed to prevent severe disease and death. And as I mentioned, it has a positive effect on reducing the risk of developing post-COVID conditions. So vaccination, but also we'd like to see, there were so many shouts for improving ventilation during the pandemic, during the crisis of the pandemic. We'd like to see those shouts turn actually into investments, actually turn into making the systems, where we live, where we work, where we sleep, to have better air, which is not just good for infectious pathogens like COVID, but for other contaminants that are in the air. So prevention and investment in that is really important to prevent that long-term sequelae.
Thank you very much. We have a question about vaccines from Farzana Rahman Benu, watching us on LinkedIn. Is there any validity period for vaccines?
Maybe I need further information on what that question is. Maybe she could write in what she means on that.
Well, Farzana, could you please elaborate more on your question, and we will make sure to take it. Meanwhile, Maria, I think we can go to the next one from Helen Mbonu, also watching us on LinkedIn. Is contact tracing for recovered patients used to study the COVID-19 variants?
So we did use contact tracing very early on and through many years of the pandemic, where you identify a case, someone who is infected, making sure that that individual receives the right supportive treatment, but then to find out who that person was either exposed to or who that person exposed. Because the idea of contact tracing is looking at all the people around that infected individual and follow them to make sure to see if they're infected or not and make sure that they get the appropriate care. That's how you break chains of transmission. We do use many different types of surveillance to track variants. That comes from testing of individuals and the sequencing of individuals. So either those patients can show up at healthcare, and now what we are seeing are samples that are coming from healthcare facilities, but we also are tracking variants through wastewater surveillance, which has been so incredibly helpful, and still is for tracking circulation and tracking variants. Right now, we know that among the wastewater surveillance systems, which we now actually put on our website, on the COVID-19 dashboard, which was revamped last year, and we're adding more information to that. You can see the countries that are doing wastewater surveillance. They're actually tracking the variants as well. That data gets uploaded to websites and platforms like GISAID and others, and then our group of experts, the TAG VE, will analyze and look at the evolution, and not just look at is there a change or not, but what does that change mean? What is the public health impact of the different mutations? So it's quite dynamic still. And we meet regularly. In fact, our TAG COVAC, which is the Technical Advisory Group for COVID-19 vaccine composition, is meeting this week to actually look at the virus circulation and look at if we need updates to vaccine composition. So a lot of stuff is still happening.
Thank you very much, Maria. There is a question actually, what is the role of research in fighting against virus-borne diseases?
Oh, research is absolutely fundamental to everything that we do. As an evidence-based organization, what we do with our member states, with experts around the world, is we convene people, we bring them together to say, what do we know about this pathogen? And some of that comes from informal information, but a lot of that comes from studies, research studies that are done. That data is shared with us, the results of that research is shared with us, and we use that to develop evidence-based guidance. And so we'll have a question, do masks work? Or what is the best therapeutic option for people who are infected with SARS-CoV-2? What is the role of infection prevention and control? All of that is based on evidence and based on research. Research is also absolutely critical for the development of diagnostics, the development of therapeutics, and the development of vaccines. In record time for COVID, we collectively developed safe and effective vaccines. But that was actually based on not just that first year of COVID, which was clinical trials and really rigorous research, looking at efficacy, looking at safety, but even research way before we even heard about COVID-19, based on mRNA platforms. And so this is a continuous, and for us, this for me as the technical lead for COVID, the fundamental role of science and the challenges to science, and the debates among the science, and especially when we had very limited information with all the uncertainties, that's where we drew our knowledge, and that's where we drew that formed our ability to develop that evidence-based guidance and support countries in developing policies.
Thank you very much, Maria. Sorry, we are getting quite a lot of new questions.
Okay.
But Farzana came back to us.
Okay.
So her question is how long the vaccine will work or protect our body?
Great question. So we continuously look at the different vaccines that have been authorized for use for COVID-19, and there are several that are out there. So it depends on the vaccine, but we look at vaccine effectiveness, and we look at within individuals and within cohorts of individuals, groups of individuals, testing their antibody levels over time to see what that protection looks like over time. It depends on the vaccine. It depends on your age. It depends on your underlying conditions, and I could give you a thesis, I think, of an answer on that. But it is something that we are looking at. We recommend, and it leads to exactly to answer your question. We use that data to make recommendations, and our SAGE group, which is a strategic advisory group of experts, makes recommendations on how often someone, depending on your risk, needs to be vaccinated. And so our SAGE recommendations will recommend people who are of the oldest age group, so people over 70, 80 years old, people with underlying conditions should get a vaccine, should get an additional dose somewhere between 6 and 12 months, depending on how at risk you are. And that duration will ensure that you have protection against severe disease and death for that long. But we do know that these antibodies wane over time. So when I mentioned at the start, it's important that not only if you've been vaccinated, but when you've been vaccinated. So just look, if you're in an at-risk group and you haven't been vaccinated within 6 to 12 months, please talk to your healthcare provider about getting an additional dose.
Thank you very much, Maria. Here's a very interesting question from someone watching us on X. What can citizens do when their elected officials and high-ranking doctors promote restriction of access to vaccines or refuse to provide evidence-based public health advice?
I think you write to them. I mean, use your voice. I think I'm just remembering many times where this came up, where Dr. Mike Ryan and I would be sitting with you, Alex, and talking about this, and use your voice and write to them. The evidence is out there. The guidance is there. Many member states, many governments, countries have their own set of guidance that are online. And it's documented of what to do, but I would advise to use your voice and speak to your representative.
Thank you very much, Maria. Here is a question then from Amanda Maristanu, watching us on LinkedIn. What is the WHO doing to prevent false information from spreading about COVID-19?
I think you can answer that question, Alex. There's a lot of things that we're doing. So maybe I'll start, and I would love for you to supplement this, because addressing questions, is something that we do as scientists and as public health professionals. What is this vaccine? Is it safe and effective? How was it developed? These are legitimate questions that we need to be answering, and we do a lot of that through Q&As, like online. We do that sometimes through this. We answer questions at press conferences. We do interviews. We put a lot of fact sheets that are out there. But addressing misinformation is something else, and addressing disinformation is also something else. I hope you talk about what we did during the pandemic and with the different platforms of the Googles and the Twitters and all of that. But I think what I want to emphasize is that this is something that we have to continuously address. We've been working with different leaders, whether these are scientific leaders or religious leaders or youth leaders or influencers, to make sure that wherever you get health workers, I should have said first, where you get your information, that those individuals have facts, have information that they can share on to someone else. And that's really important, because they're different people that people trust. And so making sure that the right information out there, accurate information that's out there, is part of our job. But maybe you can answer that question.
Thank you, Maria. Indeed, it's not the first time when COVID happened that we've faced the challenge of mis and disinformation, but it's definitely the first pandemic in the digital era. So we did also expand our digital response, and this product, this live Q&A sessions also wasn't new, but the way we did it in a very regular manner was in part as well to first update everyone about what's happening, but also to address mis and disinformation concerns and to open the space that experts like you, Dr. Mike Ryan, and others are there, open and transparent, so that our viewers and followers can ask you any questions. We did expand the partnerships with the social media and digital platforms to make sure that more people can see accurate and timely information. We've also worked with them in order to translate content, because we don't have capacity here to provide information in any possible language that people may need it. And also our colleagues have been working with different community and religious leaders so that we can reach people in different ways. And again, from people that they trust. There is a whole FIDES network developed with health professionals who are actually now not only on COVID, but on many other health topics, providing primarily TikTok videos, but also digital content in other platforms, so that also younger audiences can consume it in a way they would like to see it. So there's been a lot done. We've done quite a lot of research and testing as well on how we can improve our digital and overall communication. So there's a lot of information on our website, and I don't want to take more of our time, but indeed this pandemic has pushed us as well out of our comfort zone and to think out of the box.
And we also need to continue to invest in this, because this is something that requires attention. And I think one of the things, reflecting on how long we've been doing these, is communicating uncertainty. A lot has changed in our understanding of COVID. And that's going to happen the next time. When you have a novel pathogen, you have the next disease X, we are going to be learning as we do with you. And I think as we've communicated about this, how we talk about what we know, what we don't know, the uncertainty, what it means for you, how long it's going to take to get that answer to that question, the humility that we tried to speak with, to say we don't have all the answers, but yet here's what we do, here's what we can tell you. We've learned a lot there too, which I think will be helpful as we go forward, to say that, none of us are perfect in any of this, but I do hope our organization, but our member states continue to support us in addressing misinformation and disinformation.
I would add to that also other partners, the member states, including the tech industry and others, we need the support not only when a pandemic hits, but on many other health challenges. But
because that builds the trust, right? And that's one of the things we saw. Reacting to something, to a crisis, is very different, and everyone is really scared and quite fearful. But if we are working constantly to build that trust in quote unquote peacetime, which doesn't exist in our fields, but in terms of when, in between these major crises that we're dealing with, and you work with communities, you're listening to communities, that investment needs to be there. So yes, thanks for mentioning the tech industry. Please support.
Thank you, Maria. Well, we have quite a few more questions and running out of time.
Okay.
So I want to take this one from someone watching us from Tanzania, sent 6 questions. We're running out of time. I'll ask what I think is the most important from the list because we already addressed some.
Okay.
Could WHO share a detailed report on lessons learned from COVID-19 and their impact on policies?
Oh my gosh, that report would be very, very, very long. I can tell you that during COVID, actually during the crisis part of COVID, we had numerous reviews that were done with us. From those reviews, there are more than 300 recommendations that we've used to develop what we call the HEPR framework, which is the Health Emergency Preparedness Response Resilience Framework, which is taking those lessons and moving forward, and how do we prepare for the next one. I do a lot of presentations these days, and a lot of people want to say, what are the lessons that you learned? And I mean, we learn the same lessons every time that there's an outbreak. And we know each time, what we need to do better. There's lots of reports that are out there. Maybe we can share some links of some things there. There isn't one single report, but we are a learning organization. And I think that's really important to say, because this is something that we have to constantly work on and get better at. And I think it's also important to mention the member states that are discussing the pandemic accord, the pandemic agreement. Like, that's exactly what this is. It's like taking those lessons and saying, next time we are going to do better, and here's how.
Thank you very much, Maria. There are a few questions on preparedness for future pandemics and crises. So I'm going to summarize that and ask you, are countries now better prepared than before
DG
COVID?
answered that question yesterday at the press conference, and the answer is yes and no. I mean, in many ways, we are better prepared because we've all just gone through this. And member states, governments spent a lot of investment in improving surveillance and improving their workforce and looking at cross-sectoral collaboration, all of government, all of society approach, investing in diagnostic capacities, improving infection prevention and control in their hospitals, supporting clinicians in clinical care, improving sequencing. I could go on and on and on. Emergency operations centers, supply chain, research and development. But no, on the other hand, because a lot of those investments are going away. And I think right now, one of the things for me that's so striking is that the world wants to forget this pathogen that is still with us. And I think people want to put COVID in the past as if it's over and pretend, and in many respects pretend it didn't happen because it has been so traumatic. But that is really detrimental to future preparedness. We have to use what we've done, what we've lived through, and those of us who lived through this, because many people died, those of us that experienced this and work with our governments, because some of the leaders in those governments are not the same as they were during the crisis period, and make sure that the investments and the gains that were made are sustained as we go forward. I do think that we have some worry around trust in governments, in science, in leaders, which hampers our ability to go forward. I think the world is a lot more complex in terms of the challenges that we face, infectious disease being only one. We have climate, we have economy, we have wars. And so our work is getting harder. So there are elements of us being better prepared. We have better investments, like the pandemic fund, of looking at sustainable investments in surveillance and in workforce and in diagnostic capacities. But it's very, very hard to maintain because that fiscal space, the political attention has really gone away.
Thank you, Maria. And you rightly said a lot of people want to forget about this painful period of our lives, and rightly so. But there are many that are still suffering. And there's one more question, and I think maybe it's important to take about long COVID. Why isn't there a global initiative supported by the WHO to address and solve long COVID?
There are global initiatives that are out there, but we can always do more. I mean, I think the only answer to that question is we want to be able to do more. we need the resources to be able to do that. It's not an excuse. But we have brought together clinicians. We have monthly webinar series, and you're invited to join those, of trying to share the latest information, bringing patient groups together. There's the development of guidelines that are ongoing. We've been working with countries because we wanted to establish cohort studies in a number of countries around the world, high income and low income, urban, rural, to be able to track individuals and support individuals over time. There's much more we would like to do, but frankly, we don't have the resources to be able to do it. We're doing the best that we can with the resources to maximize every investment that's been made in this, but we would love to be able to do more.
Thank you very much, Maria. And as we're coming to closing this conversation, I do want us to take a moment, maybe if you look back and think back about those 5 years, what are the key moments that you remember of, and maybe what we could have done better?
I mean, I've been a bit in a reflective period right now, in a phase, given that it's, 5 years ago right now that the first cases were occurring. And there was this massive storm brewing that we didn't know. I think for me, there were such critical moments early on. I recall, learning of the cluster of pneumonia of unknown etiology. I recall vividly how actively we engaged here in headquarters, with our regional office in Wipro, with our country office in China, to gather information. I recall a sense of urgency and intense actions where everyone knew what they needed to do. And I think in those early days, we were extremely eager and hungry to get more information out of China, to learn what was actually happening. We used every system that we had. We immediately set up our incident management team within 24 hours at the 3 levels of the organization. We issued notification to all of our IHR focal points, and in countries and focal points, so some agencies also, around what we knew around this cluster of pneumonia, what questions we were asking, what lab results were pending. We published a disease outbreak news on the 5th of January. We published our first package of technical guidance on the 9th to the 12th of January 2020, within 2 weeks. And we did that because we adapted the MERS coronavirus. Once we learned it was a coronavirus, actually before that, we brought together our lab teams, we brought together our clinical teams, we convened these teleconferences. And on the lab side, we worked with Charité University and Institut Pasteur, and it was Public Health England at the time, and CDC in Hong Kong, and published the first PCR assay on the 13th of January. And that was used to start developing test kits, which we started shipping on the African continent by the end of January. I remember intense activity. I remember everyone coming together. I also remember the first press conference I ever did on the 14th of January. And I thought I did one, and I thought I was never going to do another one, because I was asked, and Tarek was with me. I remember I was asked, talk about coronaviruses and what do they do and what are we doing? And I recently went back and reviewed that transcript, which is pretty incredible to hear now, around saying, the human to human transmission, and we wouldn't be surprised and likely to have human to human transmission. But all the guidance that we had issued was already assuming that there was. So those early days are quite fresh. For me, the mission to China, because I was on one of the first missions to China in February 2020, is vivid. So it's very fresh still. But I just recall, and I'm so grateful for the staff here. I'm grateful for my family's support, and I'm grateful for the scientific community coming together, because it was incredibly difficult for everyone. But sorry, that was really long-winded answer there. But there's a lot that I recall. And I think for us here at WHO, and for the people that we work with in ministries, it's still fresh, and we use this to propel us forward to do better the next time. We could always do better, and everyone could have done better in this pandemic. But with the information that we had at the time is the question. And the other question is, how could we do better to have better information early on? How can we work with member states to make sure that they're doing the right surveillance and that they're transparent with that information? So there's a lot that continues to need to be done for COVID because it's still with us, but also to prepare for that next one.
Thank you very much, Maria. And I'm glad you mentioned as well how much has been done in the first 2 weeks and in the first month, because there have been a lot of misconceptions about the response later throughout the pandemic. But as we're coming finally, I think, to the end of this conversation, what is your message to our viewers before this holiday season? We've had many of those conversations when times were tougher in the pandemic, and when we couldn't really be with each other or celebrate with each other. Seems that at least from COVID-19 outbreak perspective, it's a little bit better. But over to you. What is your message today?
COVID is still with us, but there are many pathogens that are circulating. And so, around this holiday period that is coming up, there's going to be a lot of travel. People are coming together. Do it as safely as possible. Celebrate the moments that you have. Life is precious. And I think people who are out there, they're very smart. What I have been so impressed with during COVID is this desire and this interest in just learning. And I think we've tried our best to try to communicate information to an educated public who want to know, what can I do? How can I take some control? The message is, to have a wonderful holiday, to travel safely, to take a risk-based approach, make sure, your vaccines are up to date, not just for COVID, but also for flu. For young children, there's a lot of vaccine preventable diseases. Make sure your kids' vaccines are up to date. We will continue to work through the holiday period and to make sure everyone stays safe, but also just be kind to one another. We've seen, I think, during this pandemic, the worst in people, but we've also seen the very best. So our, actions of those early days, it's all documented. We're all online every day. And so those misperceptions or misconceptions of what we've done, you can go back and really see. But our job, and only job, has been to help people and to do our best to keep people safe using the world's best minds and working with individuals, listening to individuals. So I think there's a lot, everybody has a role to play. And even during the holiday period, keep yourself safe, keep your loved ones safe, and have a wonderful holiday.
Thank you very much, Maria. And I do want to thank to our viewers as well for being with us, for participating in the conversation, for trusting us, for also asking us some tough questions at times, including today. And for all of you watching us from Sudan, India, Thailand, the US, the UK, France, Germany, Serbia, Canada, Zimbabwe, Bangladesh, Sweden, Norway, Mexico, Brazil, Argentina, Japan, Australia, Switzerland, Zambia, Tanzania, Qatar, and many others.
Oh, wonderful.
Thank you very much. I'm joining Maria in wishing you to have great holidays and to be safe until next time we talk to you here.